Hey folks, Professor Finn here. We're going to continue our study of pathology by going into Chapter 8 of Pathology Microbiology for Mortuary Science students by Mullins. But before we get into that, take a moment to like, share, subscribe, share this video on your social media. Let people know it's out there. Help a person get through their mortuary science education or prepare for their board exams. Let's go ahead and get the presentation up and running. And let's talk about neoplasms and cysts. Probably one of the more important chapters out there because it's dealing with cancer. So, cancer is the second leading cause of death in the United States, second only to cardiovascular disease. Cancer is still not well understood, and in many circumstances, cancer is curable if discovered early and treated successfully. The truth is, that is applicable to probably most disease, right? If it's discovered early and it is treated successfully, then you have a good prognosis. So, neoplasia means new and growth. A neoplasm is a tumor, and oncology is the study of neoplasms. Characteristics of tumors. These growths are abnormal because they shouldn't exist in the body. Neoplasm cells do not respond to normal growth controls and act as parasites on cell growths. Melanocytic nevus, or a mole, is a benign tumor that arises from skin cells for some idiopathic reason from the natural skin replacement process. Not all tumors are cancerous. So, two categories of neoplasm. Benign, also known as non-malignant. These are non-cancerous tumors. They're not recurrent or progressive. They're localized and do not spread. They do not appear after surgical excision. They resemble surrounding tissue and can still be responsible for serious diseases, even though they are quote-unquote not as serious as a true cancer. There is also malignant, which are cancers, and cancer comes from the Latin word for crab. These are malignant tumors that infiltrate tissues with crab-like extensions, causing severe damage. These can spread or metastasize. They can reappear after excision. They do not resemble surrounding tissue. They cause total body changes, and they are lethal unless treated. Neoplasms are termed 1 to 4 depending on malignancy. 1 is least malignant, 1 and 2 are low grade, and 3 and 4 are high grade. So for instance, a mole, which is benign, does not destroy tissue around it, but a skin cancer, such as a carcinoma, would. All neoplasms are composed of 2 portions: the transformed tumor cells and the supportive connective tissue. Neoplasms have a blood supply like all living tissue, and all tumors come from 4 basic body tissues: the epithelial tissue, connective tissue, muscle tissue, and nervous tissue. Within the epithelial category, we have simple epithelium, stratified epithelium, and endothelium. Now we're going to get into naming tumors, and this can be no small amount of grief. So pay attention, listen to this thing several times if you need to. Benign tumors, non-cancers, typically have an OMA suffix, lipoma, chondroma, things of that nature. Not always, because there are some malignants like that, but generally speaking, if it just ends in OMA, it will indicate a benign tumor. Malignant tumors, such as sarcoma and carcinoma, always indicate cancers, true cancers. There are exceptions to both of these. So a sarcoma typically comes from connective tissues, carcinomas typically come from epithelial tissues, and when it comes to true cancers, malignant tumors ending in OMA, these are the ones you need to memorize: glioma, lymphoma, melanoma. There you go. That's the exception to the rule. You have 3. Gliomas arise in nerves, lymphomas arrive out of the lymph tissue, melanomas come out of skin. So let's start with significant benign tumors. First up is adenomas. If they arise in a pituitary gland, so this is an epithelial tissue tumor. An adenoma, if they arise in pituitary gland, signs and symptoms will include loss of menstruation, spontaneous lactation, infertility, underdevelopment of testicles, decreased sex drive, impotence, gigantism in children, and acromegaly in adults. If an adenoma arises in an adrenal gland, signs and symptoms can include Cushing's disease, upper body obesity, severe fatigue, muscle weakness, high blood pressure, backache, elevated blood sugar, easy bruising, bluish-red stretch marks on skin, lack of or cessation of menstruation, and growth of facial and body hair in women. Papillomas are wart-like tumors caused by human papillomavirus. Exposure to HPV may not result in conditions for years. Papillomas are diagnosed by biopsy in males or pap smear in women, and there are two types of abnormal tissue: the condyloma, which is the wart, and dysplasia, which is precancer. Dysplasia is a presence of an abnormal cell on the surface of the skin. It is not necessarily cancer, but can lead to cancer. Smoking increases the chance of developing dysplasia, and stopping may reduce reappearance after treatment. Papillomas. Signs and symptoms of papillomas include tissue changes on the feet, hands, vocal cords, face, and genitals. Complications can be that these papillomas can grow large enough in the larynx to impair respiration, and the treatment for papillomas is surgical removal. Polyps can be found in the intestinal tract, trachea, esophagus, stomach, small intestine, or colon. Basically, the entire digestive tract. Polyps can range in size from a few millimeters to several centimeters. They are precancerous, and treatment involves surgical excision to stop bleeding or blockage of the bowel. In connective tissue, we find osteomas, which are benign tumor of bone tissue. Commonly found on bones of the face and skull, but can also be found on the clavicle, pelvis, eye, tongue, or extremities. They're asymptomatic and not usually treated, and they may result from an inflammatory reaction. Chondromas are benign cartilaginous tumors of the meninges that arise from near the base of the skull, near the pituitary gland, and they are very rare. They are slow-growing, typically asymptomatic, and surgical excision is possible. You have lipomas, which are benign tumors of fat cells. The common soft tissue lesions, but are unusual in bone. They commonly grow within or between muscles, may be associated with nerve paralysis, bone deformity, and carpal tunnel syndrome. Soft tissue lipomas likely are going to be present in tissues of the back, extremities, and thorax. And synovial lipomas are found in the knee. Angiomas are benign tumors of the blood vessels. They can be located anywhere in the body. There are several types of angiomas. The first is a hemangioma, which is that found in blood vessels, lymphangiomas, which can be found in lymph nodes, and birthmarks or hemangiomas of the capillaries. These are usually treated for cosmetic reasons, and this is done through either electrification or liquid nitrogen, and they may reoccur after removal. Fibromas are benign tissues of the fibrous tissue. You have ossifying fibromas, which are firm and gritty and involve the maxilla and mandible. And you have aggressive juvenile ossifying fibroma, which can destroy the maxilla and adjacent structures. These can occur in ovaries and can synthesize both male and female sex hormones in the ovary. Within the muscle tissue, you have rhabdomyomas, benign growth of the muscle elements within the muscular walls of the heart. The most common primary cardiac tumors in the fetus are rhabdomyomas, and 50% of cases associated with tuberous sclerosis. Leiomyomas are benign tumors of the smooth muscle. They may originate anywhere there is smooth muscle. Uterine leiomyomas are the most common neoplasms of the female genital tract. That is important. Uterine leiomyomas are the most common neoplasms of the female genital tract. It is one of the most frequent reasons for surgery during a woman's reproductive years. Nervous tissue. Neuromas are benign tumors of the nervous tissue. They may not intrude on organs, but may cause pressure on them, which can be fatal. We will now move on to significant malignant tumors. First, we have epithelial tissue, and these are melanomas, which begin in the melanocytes, and it is responsible for the most skin cancer-related deaths. It is curable if detected early, and the chance to develop melanoma increases with age. It affects all age groups, and it is the most common cancer in young adults. It is exacerbated by exposure to sunlight, and these may metastasize to the lymph. Signs and symptoms of melanomas include growth that increases in size and appears brown, black, red, pink, or multicolored. A mole that changes color, texture, or grows larger than a pencil eraser. Spot or growth that itches, hurts, crusts, scabs, erodes, or bleeds. Sore that lasts for more than 4 weeks or heals and then reopens, or a scaly bump that grows a projection similar to a small horn. Squamous cell carcinomas are the second most common skin cancer. Two-thirds of all skin cancers are squamous cell carcinomas. These resemble squamous cells of the epidermis and will usually remain isolated in the epidermis but will penetrate if not treated. They are most common on sun-exposed parts of the body. They may be inherited or caused by sun exposure. Individuals with dark skin are less likely to get this cancer than fair-skinned individuals. Adenocarcinomas are malignant epithelial tumors with tubular, acinar, or papillary growth patterns or mucus production by tumor cells. They look like gland tissue and can produce fluid. They're likely to occur in the lungs, esophagus, colon, or parotid salivary glands. They are the most common type of lung cancer. They may result from scars caused by previous diseases and trauma to the lungs. Transitional cell carcinoma is a malignant cancer of the transitional cells, and it is the most common cancer of the urinary system. It is twice as common among Caucasians than African Americans. Symptoms of transitional cell carcinoma include bloody urine and dull pain caused by gradual obstruction of the urinary system. Workers in chemical, coal, and plastic industries are at high risk for transitional cell carcinoma. Basal cell carcinoma. Basal cell carcinoma arises in the basal cells of the epithelial tissues of the skin. It is one of the most common forms of skin cancer and is the most common form of all cancer. It is common in older men who spent time outdoors. However, age is decreasing as well as women acquiring this cancer. Causes of basal cell carcinoma can include chronic exposure to sunlight, contact with arsenic, contact with radiation, complication of burns, scars, vaccinations, and tattoos, and basal cell carcinoma can be found on the face, ears, neck, scalp, shoulders, and back. Signs and symptoms of basal cell carcinoma include open sore that bleeds, oozes, or crusts and remains open for 3 or more weeks, a reddish path that crusts, itches, or hurts located on the chest, arms, shoulders, or legs, a shiny bump that is translucent or pink, red, white, black, or brown, a pink growth with an elevated border and a crust indentation in the center, appearance of tiny blood vessels on the surface of a growth as it enlarges, a scar-like area that is white, yellow, or waxy with poorly defined borders, and shiny and taut skin around a growth. Connective tissue. Osteosarcomas are a form of bone cancer that appears as a hard white tissue with scattered areas of flesh-like tissue that bleeds. It often spreads to the lungs in early stages and may invade joints and ligaments. Survival rate good if it responds to chemotherapy and surgery. If not, responsive to chemo, amputation is required. Chondrosarcomas are a bone cancer that affects the cartilage cells of the femur, arm, pelvis, knee, and spine. The ribs may also be affected. It is the second most common cancer of bone between the ages of 50 to 70. This may be inherited. Signs and symptoms of chondrosarcomas are a presence of a large mass in the affected bone, feelings of pressure around the mass, pain that is worse at night, pain that is not relieved through rest, and pain that may be present for years but increases gradually over time. Liposarcomas are fatty cancerous tumors that grow in deep connective tissue spaces. They're primarily found behind the knee, medial thigh, behind digestive organs, and in the shoulder. Liposarcomas can be found in the lower extremities of children, and there is a high mortality rate associated with liposarcomas. 2/3 of children with liposarcoma are boys, and they can appear as early as 14 months and in adolescence at age 13. Treatment for liposarcoma includes surgical excision, and recurrence is likely. Angiosarcomas are uncommon malignant neoplasms that grow rapidly from cells derived from vessels. Spreads quickly through lymph, more common in skin and soft tissue but can occur anywhere, and it has a high mortality rate due to symptoms showing late. Angiosarcoma of the liver is more common in males, while angiosarcoma of the breast is more common in premenopausal women 30 to 50 years old. Hemangiosarcomas can be found in blood vessels, and lymphangiosarcomas can be found in lymph vessels. Fibrosarcomas are a cancer of the bone that is large, destructive, and malignant, consisting of fibrous tissue. Occurs mostly in the extremities, results in pathogenic bone fractures, and recurrence after treatment is likely. Lymphomas are malignant tumors that result during lymphocyte production. Lymphomas can grow in many parts of the body, including the lymph nodes, spleen, bone marrow, bone, or other organs, and there are two main types: Hodgkin's disease and non-Hodgkin's lymphoma. Symptoms of lymphomas include painless swelling of the lymph nodes in the neck, axillary space, or groin, swelling in the legs or ankles, abdominal discomfort or bloating, fever, weight loss, night sweats, chills, lack of energy, or pruritus or generalized itching over the body. Within muscle tissue, we have rhabdomyosarcomas, which are a rare, fast-growing tumor of soft tissue. 50% of all sarcomas in children are rhabdomyosarcomas. They are more common in children among ages 1 to 5, but also affects adolescents 13 to 15. Rhabdomyosarcomas can be found in the head, neck, urogenital tract, and extremities. Diagnosis is often delayed due to lack of symptoms, and this is often found during exams for other diseases, and it has a high mortality rate. A leiomyosarcoma is a malignant tumor of the smooth muscle. It frequently metastasizes to the lungs and may get to the liver if it starts in the stomach. This can develop on any site in the body, but is most common in the uterus and the stomach. Nervous tissue. Brain cancer arises from glial cells. This occurs in the frontal and temporal lobes of the cerebrum. There are 3 types depending on the cells they originate from: astrocytomas, ependymomas, and oligodendrogliomas. All of these have a high mortality, and they are more common in men than women. With gliomas, common signs and symptoms include headaches, vomiting, visual impairment, changes in mood, behavior, and personality, paralysis, and problems with coordination, speech, and memory. Cysts. A sac within or on the body surface containing air or fluid, closed pocket or pouch of tissue that can be filled with air, fluid, pus, or other material is a cyst. The first cysts that we will be looking at are ovarian cysts. These develop in the ovaries, and they have more than one chamber. These are not malignant, but can cause other fatal complications if not treated. They may be present at birth or occur late in a woman's life, most commonly found during childbearing years. Ovarian cysts may mask other conditions such as cancer, ectopic pregnancy, or appendicitis. Ovarian cysts may resolve naturally during a normal menstrual cycle and are usually asymptomatic. Rupture will lead to a sharp, severe pain. Complications of ovarian cysts can include inflammation, spontaneous bleeding, increased cyst formation, infection, blood clots, emboli in lungs, blood poisoning, and death. Sebaceous cysts, as known as epidermal cysts, keratin cysts, or epidermoid cysts. These are product of swollen hair follicles or trauma to the skin. They're found just under the skin, containing a cheese-like or caseous material. They are slow growing. It's a painless lump, but may become inflamed and painful later. Sebaceous cysts typically do not require treatment. If they form an abscess, they may need to be surgically excised, and recurrence is typical. Non-neoplastic changes. Cells adapt to their environment through hypertrophy, hyperplasia, and metaplasia, and this does not necessarily signal the presence of a neoplasm. A non-neoplastic change, however, may mask an underlying neoplasm, which is why it's important to get checked out. There are 7 most common conditions encountered as a result of neoplasms. The first is emaciation, or the state of being extremely lean, dehydration, and cachexia, which is the malnutrition and wasting away of the body. With emaciation, you have to be careful about the types of chemicals you use. You really want to try to stay away, if at all possible, from very harsh, high-index chemicals, because emaciation and dehydration are usually found together in the same type of situations. Cachexia is a severe form of malnutrition. A person can be healthy and exhibit proper moisture while being emaciated because they are extremely lean. But if you are cachexiated, that means you have a severe malnutrition. And in those type of situations, the musculature is usually not in very good condition. So it is not going to react well with your preservative. So you need to take into consideration the fact that you have very poor muscles that will probably decompose quickly if left unattended. You have discoloration, hemorrhage, tissue deformation, and extravascular obstruction. Well, if it's discoloration, you will treat it however you can treat it. If it is within the arteries, then you'll be able to flush it out during injection, either through single point, multi-point, or restricted cervical injection. If you have hemorrhage, you will more than likely have to go to a multi-point injection, because you will have to get around where the opening of the hemorrhage is. Tissue deformation is really, just like extravascular obstruction, is probably going to be more about putting pressure on areas and causing problems with distribution. In those type of areas, you really want to go very slow. You do not want to push too hard too quick, and if you just can't get any results, you're going to be relying on supplemental injections such as surface packs and a hypodermic injection. Severity of debilitating factors is different for everyone, although expect the following: excess fluids near tumors, alopecia or loss of hair, jaundice, which if you're encountering jaundice, you're going to need to either use specific fluid for that, or if preservation is the only thing you can go for, you need to inform the family that you are going to have to use heavier cosmetic than you prefer. Blood clotting disorders, and prosthetic devices, which prosthetic devices should not be a huge problem for you as the professional embalmer. You can take them off and put them back on. Blood clotting disorders simply means you need to be aware of the fact that you may be dealing with basically blood sludge when you're injecting, and that you need to be careful and smart about how you perform your injection. All right, folks, that concludes this lecture. I will see you next time. Make sure you take a moment to like, share, and subscribe on this video. Share it with a friend. Go ahead, post something in the comments below. Let me know what you think, or email me at askbigbadfinn@gmail.com. Always like to hear from people who view my videos on the channel, and we will see you next lecture.